All right, everyone, we're going to go ahead and get started. Hello and welcome. My name is Micah Matthews. I am one of the marketing directors here at Messer Financial, and I am super excited to be able to present what we're going to be presenting today in our partnership with Cigna. We've got Nick Hiopa, who is the broker manager with Cigna, to present today. And, you know, for those of you that have been on our previous webinars during this ACA week, because this is part 3, one of the common themes for each one of these is opportunity. And now the definition of opportunity can be relatively flexible, right, as far as what we consider real opportunities. Well, today, what we're going to be presenting is one that I would call a major opportunity. When you've got a carrier with the name recognition of a Cigna that's coming in with the products that they're coming in with, the rates that they're coming in with, and not only expanding into 6 or 16, but over 60 counties in the state where we are based out of, in North Carolina, I would consider that a big deal and a big opportunity. So if you're ever looking for a time to get in the ACA, like I've said in all the previous webinars in our introduction to ACA webinar, this is the year for ACA to really explode. But before we get into that, and I will be handing it over very shortly, there is a few things that I want to make sure everybody is aware of. What you're seeing on your screen is our website, messerfinancial.com. Okay, everything that you're basically going to need is on this website. On the home page, if you notice here on the calendar, there's dark areas. And if you notice, for this week, for example, there's one scheduled every day of the week. So this is our ACA week. If I click on the 23rd, which is today, it'll tell you where the webinars are. So if you ever want to know what upcoming events are for Messer Financial, one, I'm sure you'll get an email about it. But if for some reason you missed that as well, you can always come to our website and register right here for it. Also, we do have information on here that will help you if you are new to the industry. If you are needing information on FFM certification, you can get all of the information you need right here on our homepage. If I click Learn More, it's going to tell me how to certify, gives you a training guide. If you're a new agent, what they consider a new agent is someone who either has never done an FFM certification or someone who didn't complete their FFM certification last year. So even if you've done it before, if you didn't complete it last year, you still need to complete it this year. So you would be as a new agent, or if you're a returning agent, you can do this. Help on demand. For those of you guys who don't know what that is, I highly recommend you signing up. If you click on this Help on Demand, it's going to show you everything you need to do on how to sign up for it. And what it is it's through healthcare.gov. So any client that goes into healthcare.gov that is looking for support and requests support from an agent, those clients will be distributed to the agents that sign up with this. And this is exactly how you sign up. So basically, it's a free lead source that you can set the criteria, what time you want them, what language, etc., things like that to fit your criteria. Obviously, the more flexible you are, the more leads you would get, but you can fit it to fit whatever you're wanting to do. So again, I highly recommend sign up for Help on Demand if you have not yet done so. Another thing I wanted to show you on our website is we do have under Agent Resources, our online contracting. For those of you that are not contracted yet with Cigna, after today, I'm sure you're going to want to. So if you don't know how to get to our contracting site, it's under Agent Resources, online contracting, and it's going to take you right to our contracting system. Create your profile if you don't have one yet, and then make sure you request those appointments as soon as possible. As we get closer and closer to the open enrollment period, the carriers get a huge influx of new agent appointments, and it slows the process down. So if you're wanting to be able to be ready to sell by November 1st, get your contracts in as soon as possible so you don't miss that cutoff, because I assure you, you're going to want that. And that's how you contract. And then the last thing, we also have a quote and enroll tool that does both Medicare Advantage and ACA. It's called MyMFG Platform. Messer Financial created it, and it is free to use for anybody who partners with us on the ACA. And we do have webinars for it coming up in October to go over the ACA side. We've actually just recently done a few for the MA side. So a lot of good training still to come. And if you ever want to just run a quick quote under this Agent Resources tab, Quote Tools, there's a bunch of different quoting tools. We have basically a quoting tool for every type of product. But for this purpose, we'll say ACA. I hit Health Quote, and it takes you right into the platform. So obviously you'll have your own platform where you'll be able to use whenever you're actually appointed. But if you're just wanting to, like I said, run a quick quote and see who's available in your area, this is a very good tool to use and to get a good idea. Also, if you are partnering with ACA, guys, I highly recommend it, especially in some other states. There's a lot of, I guess if you would say, unethical agencies where they may try to hold you hostage and your appointment hostage and not release. So make sure that you partner with someone that you can really trust. With Messer Financial, so everyone knows, in our Messer agreement, which every agent must sign before they contract with us, we have an open release policy, and it states that if for some reason you ever do decide to leave, that you get to take your business with you and you continue to be paid on those policies for as long as they're enforced. Guys, we are eliminating any risk to give us a chance and to partner with us, and I assure you, when you do come on board, and if you do give us that chance, we're going to do everything in our power to earn that business. After all, this is a partnership, and it does us no good to contract people if you're going to fail. So we are vested in you from day one, and that means that we are going to do everything we can to make you a success and provide that to you. Okay, so we have all kinds of different trainings under Agent Resources. Again, that's a very popular tab. There's a Messer Learning Center. On here, we post all the webinars that we do. So if you missed one or you want to go back and review one, you can go to this website and you'll notice here's all the different ones we just added. So if you're new to the industry on the ACA, I would highly recommend tuning into this introduction to ACA. I basically go through the entire history of how it developed, where it is today, and where I see it moving forward. And we also have some other guest speakers in there as well that give some great information. So again, if you do have questions, concerns, anything, use us as much as you possibly can. You can contact us at this number here, 866-568-9649. We have several different departments. We have a contracting department, a commissions department, marketing department, all of these different departments so that we can support whatever you're looking for. Because at the end of the day, we want you to focus on what you guys do best, and that's selling and making money and helping people. So if we can do all three of those things, and by eliminating some of the workload off of you, that's what we want to do. So those are just some things, like I said, I want to show you. Feel free to contact us anytime. I will say that you should see a chat box on there or a question box. If you have a question, please type it in. We will be answering them as we go. And also at the very end, we'll have some time for Q&A. So again, I want to thank everyone for taking the time out of your busy schedules to join us today. I think it'll be definitely worth your time. And with that, Nick, I'm going to turn this over to you and let you present. So thank you very much, everyone.
Yeah, thanks, Mike. I appreciate that. All right, can you guys see this okay? Is this good?
We can see it.
Okay, cool. All right, so first off, I'll start. Thanks for having me on, everyone. I appreciate you guys joining. We're super excited about partnering with Messer. I can honestly tell you I have a lot of internal meetings, and you guys come up quite a bit from a distribution standpoint. We're excited to see what we can do this year. Cigna is having an aggressive year, but I would say it's just going to be the beginning of what it looks like for us from an IFP standpoint. And we're going to go over that a little bit here now. So OE21. So the agenda is basically we'll do a welcome, what Cigna stand for, essentially who they are. For those that might not know, I know Cigna is a global brand, but not everyone is totally familiar. 2021 overview, we'll go over some of our new plan designs, market solutions, some of the member tools, a little dental commission update, and 2021 market expansion. So I'm going to go over some specific states today. So it's going to be North Carolina, Tennessee, and Virginia. I'm going to touch on Florida, but we're still waiting on a few things there. So we're actually going to kind of urge you guys to join the state-based webinar, which I'll get the information to Micah, and he'll have that to all of you to join on that, because we're still kind of waiting for some stuff, whether it's with the DOI or some network partners to kind of hash itself out. All right, so let's get started. So Cigna as an entity, we've really updated what we want to look at as our enterprise strategy. And this isn't specific to IFP. This is for all of our lines of business. Now, just for a background, IFP falls into what we consider our government business. So Medicaid, Medicare, and then our under 65 plans. And really what we look at here as a company is, we're trying to address the needs of our members and what's going on currently within the country from a healthcare perspective. So some of those things are focusing on affordability, predictability, and making things simple. So obviously we know there's a cost issue in this country when it comes to healthcare. So we're doing what we can as an organization, and within the IFP segment is we're really able to differentiate ourselves from some of the other, what I would call upstart individual carriers, by leveraging some of our commercial rates and things like this to drive costs down in these IFP markets for an affordable option to our members. And that's why we're going to see us be very competitive from a pricing standpoint in a lot of markets this year. When it comes to predictability, we're trying to build out tools for our members to really make everything predictable within their healthcare journey. We don't want surprise medical billing. We don't want them going out of network. We want to make sure everything they're doing, they know what's going on and they know what to expect from the product that they're buying. I think there's a lot of buyer beware out there, not in just health insurance, but in insurance in general. So we want to bring that barrier down and have people understand kind of what the product they're buying and what they're getting into with us as an organization. And then lastly, making it simple. I think I can speak for a lot of us on the call, and I'm sure there's a lot of folks that have been in the insurance business a lot longer than myself. But you know, things can even get confusing for us, and we work in the industry. So imagine what that is like for a customer. So there's a lot of complicated things going on, and I think that's really one of the biggest assets that a broker brings to the table when it comes to dealing with customers and the end consumer for Cigna, is we look at you guys as not only a distribution partner, but really an information partner. You're going out there and giving folks information on our product and plans. So we rely on you to get that to people and make it easy for them to understand. So I also wanted to just touch on COVID-19. So one of the things I think Cigna is really proud about this past year is we were really the first carrier out of any company to waive cost sharing for diagnostic tests and treatment for COVID-19. You know, this was obviously a big, I would guess you could call it like thing that we did, because we were the first carrier, and at the time, no one really knew what was going to go on with COVID-19. We didn't know what this was going to have from a claims utilization standpoint and things like that. So Cigna really put its money where its mouth is by trying to help folks in the community by waiving these costs, and you saw a lot of carriers after that follow suit. We made it easier for people to get treated. We expanded our virtual care and digital tools and making all of these things 24/7 support related. I think telemedicine had some massive utilization jumps this past year, and as they have started to come down a little bit, I don't think they're going away. I think they're here to stay, which I personally think is a really good thing for the customer. So that's another thing. And then we leverage, you know, our product. And when I say our product, I mean Cigna as an entity. You know, we're a global company. We have lots of partnerships with lots of big firms. A lot of people are probably familiar. We bought Express Scripts, I believe, 3 years ago, and some of those parts of that partnership of bringing them under the Cigna brand is starting to pay off. And this is things where we're able to offer free home delivery on 90-day supplies for any medication. So this is clearly a big deal in the COVID landscape that we're dealing with right now for folks that don't want to go to pharmacies. And then next, for the community, so Cigna is very committed to the community. I've worked with another carrier in the past, and coming to Cigna, I would say it is impressive on how much they focus on the community, even when we do, you know, some of these big broker or event webinars like we're doing now, and normally we would maybe send out a little gift or a little tchotchke or something. We've actually taken that money, and a lot of times we'll donate it to charities. I know Messer can speak on behalf of this, and we take that money and we try to redistribute it wise. You know, it's nice to give folks something here and there for attending an event, but it's also nicer to feed, you know, 1,000 mouths at the same time. So we're definitely committed to that. We've been covering dental PPE for all of our dental providers, which is over 90,000 dentists in this country. Donated $1 million to the Cigna Foundation, which is really addressing food insecurity in the country. And then the Healthier Kids for Future, which is delivering 2.5 million servings of food to the doorsteps of almost 7,000 families. So again, just really, I like to touch on this. I think it's like a feel-good thing from a carrier standpoint. You know, we definitely are committed to not only our members, but the communities that we are involved in, which are everywhere in the country. Not from an IFP standpoint, but from a brand standpoint. Okay, so look at 2021. So the first thing I want to touch on here is our footprint. So if the states are in red, that means they are a current state with no expansion. If they are in orange, they're also a current state, but they are the ones that are seeing expansion for us this year. So going into 2021, 2022, 23, 24, Cigna is going to continue to double down on our expansion efforts year over year. But for this year, it was really about kind of doubling down in market, right? Like where we are currently, we wanted to expand our product in those states. And then as we go forward, you'll start to see us going into new states. So some of the big ones, or I shouldn't say the big ones, but the only ones are Colorado, Florida, which, I mean, Florida for folks on the phone it's the biggest ACA market in the country. It's going to be pivotal to our growth going forward, and you're going to continue to see us have big investments in that market specifically. In Illinois, we're rolling out a new network, which is pretty great. It's a co-branded product with Northwestern. I don't know if anyone's familiar with Illinois, but that's basically the premier product in the Chicagoland market. So very big deal. I'm very excited about that. And then specific for folks on this call, North Carolina. North Carolina is going to be our biggest expansion state to date. And we're going to go into a lot of what that looks like later in this webinar. And then in Virginia, some small expansion into a county called Spotsylvania. All right, so this is another one when we're talking about a product landscape. So we're rolling out a diabetes care plan in all markets. And the plan is pretty much exactly what it sounds like. This is specific for diabetes or diabetic customers. It's going to cap their insulin costs, and these aren't like generic insulins or anything like that. These are preferred brand insulins. It'll cap them at a $25 out of pocket for a 30-day supply. $0 for diabetic supplies, diabetic management training, labs and exams. And why I think this is important is anyone on this, I'm sure many folks on this call know folks that are diabetic. And people who are diabetic typically aren't just paying for diabetic medication, they're paying for a lot of other medications on top of that. So by being able to really reduce their costs the best we can, I think it's something important and that we are committed to going into this year. And you'll see things similar to this in the future, like we'll talk about it in Virginia, something that we're doing for a unique plan there as well. The next one is off exchange options. So we're going to be introducing 2 off exchange options in all of our markets. And I would really classify these as, targeting the ICHRA community. So for those that aren't familiar with ICHRA, maybe you've heard about it, maybe you haven't. The best way to describe it is essentially a small group employer can give a dedicated amount of funds to his employees or her employees to go out and purchase healthcare plans, customizable options. So for those of you that sell small group products, I mean, how many times have you been close to having something go through, putting everybody on a carrier, and then that one employee is like, well, I need X carrier because they have X hospital and network, and the one you're selling doesn't, and blows everything up and makes it relatively complicated. So the real story about ICHRAs is it's just a more customizable option for employers, and it can really help them cut costs in general. Employers these days have 26-year-olds, and then they also have 55-year-olds. So their needs are very different, and the plans that they want are very different. So we're going to be rolling out 2 new plans, and I would define them as very much similar to employer plans. They're just very robust, very rich plans for this community. Okay, some of our tools for our members. So a lot of carriers now, they have apps. I previously worked at Oscar, very tech-forward company. They also have an app. But I would say a lot of carriers at this point are on this playing field. And the idea is really to have an app at their fingertips, right? Or their healthcare journey at their fingertips is really what I should say. And what I mean by this is they can get information on their claims. They can see their deductible accumulators. If you forgot your ID card, it's accessible within here. This is where your virtual care is accessible. And we have things that I'm going to go into next, like the One Guide, which is really someone who is dedicated to you. So again, a lot of carriers are rolling out what I would call, in quotations, a concierge model, where people are dedicated to these consumers and helping them, kind of hand-holding them through the healthcare journey. Again, going back to that enterprise strategy of simple, making things simple for the consumer to understand. So these folks can answer any of their questions. My personal experience with it is I have a relatively bad back, and so I reached out to my guide in the app, and I personally decided to just write rather than call, and I was surprised to see how fast they got back to me, which was nice. It was almost instantaneous. It was like going through a text message. And I was just like, listen, is chiropractic care covered on my plan? He told me it is, and this is how much it costs. And these are some of the providers and network near you. So that's just one of many uses. But really the idea is anything that goes on in your healthcare experience can be addressed through this. So you get a bill in the mail, you have questions on it, they can mitigate it. It's pretty great. So the One Guide, very similar to what it sounds. It's one guide dedicated to you. So you have one person within the organization who's completely dedicated to you as a consumer, which is great. We also have a lot of co-marketing materials for our brokers that have things like this that you can send out to your customers or prospective customers, kind of educating them on what are Cigna, what are some of the tools that they offer you, and why they might be a good carrier to look at. But for this one, again, I'm just piggybacking on what I said before. It's about finding quality care, avoiding those unexpected bills, trying to make people engaged in their healthcare experience, because when they're talking to us, we can drive down their costs. Hey, where's the nearest in-network hospital? Here it is. Here's where it is. Where's the nearest in-network specialist? They're right here. So these are all some of the things that we're able to do, and it's driving behavior. And when we're able to drive behavior as a carrier, ultimately it's going to save money for the consumer, which is great. And then we have a lot of the data to back it up. This is very like elementary level data. 45% of our customers that use One Guide are able to go to high performing networks, which was resulting in almost 30% fewer ER visits, because they're not just going right to the ER, they're going to maybe an urgent care or a doctor where it's a more affordable option. And again, increasing that engagement to drive better outcomes is going to save some money for these folks, which is great. And really avoid unexpected bills and all the things you can think about when we talk about the issues with healthcare going on in the country. So virtual care, like we were talking before. I think virtual care is great for not only the consumer, but maybe they have kids. So if anyone's a parent on the phone, think of those situations where your kid was sick, woke up, maybe they had pink eye or something like that. You had to call out of work. You had to get an appointment with the doctor. You had to go to the waiting room, sit there, wait to see a doctor. Then you had to go to the pharmacy to get a medication. All this could have been done over the phone. So I think virtual care is, again, definitely here to stay. One of the things I love about it, our option, is it's not only phone-based, but we also have a video option accessible as well. And it's 24/7, 365. So pretty much any time of the year, someone can use the service, and they can use it anywhere. So one thing in the ACA market for folks to know is a lot of the products are not PPO. So they're either HMO or the EPO plans. So meaning these customers can't really leave their service area to seek care. And when they are out of the service area, unless it's an emergency, so they break their arm, surprisingly, strep throat is actually an emergency service, but things like that you can think of, they're going to get an out-of-network charge. So if you have someone who's like, hey, I want to get a plan, I travel for business, but the PPO option in my market is crazy expensive. Well, they're able to use this. So if they live in Raleigh, North Carolina, but they're traveling to Denver for work and they get a cough and they just need to get an antibiotic or something, they can easily just pick up the phone and call, and it's not going to be an out-of-network charge. It's probably going to be a $0 fee overall, which is great. And then another one that I've seen a lot in the past is, let's say you're signing up a family on a policy, and they have a child who goes to college. So again, let's just use Raleigh as an easy example. And the kid goes to school, he's a Georgia Bulldog, goes to school at Georgia. They want to make sure he or she can have care, because kids don't typically have big issues. They can use the virtual care option. And then God forbid there's an emergency, that's also going to be covered in network. So that's one of the ways I like to position virtual care when you're talking to consumers and trying to educate them on why it's important and why they should think about maybe their needs differently, and how it's really going to save them a lot of money from having to buy that PPO option, where the reality is 95% of your care will be done right in your area, and then those emergency services wherever else you might be. So again, very cost effective is the way to think about it, and convenient. You can wake up in the morning, you can call somebody if you have any of these symptoms here. I like to think of them as, minor symptoms. If you break an arm, you break a leg, you obviously don't want to use virtual care. But if you have a fever, you have an earache, allergies, pink eye, rashes, things of that nature, this is a great option for folks, and it's going to save them a lot of money. And it's the same thing with behavioral. I would say Cigna is a bit ahead of the game when it comes to some of our other carrier counterparts by offering behavioral virtual care as well for things as bipolar, depression, eating disorder, the list goes on. And I think mental health has definitely taken a forefront in this country, especially during the COVID crisis. So this is another great way that we're able to, really support our members. Okay, so let's start talking about the markets, and we're gonna lead with North Carolina here. So we're gonna look at Raleigh-Durham. So we are super excited about North Carolina this year. In the Raleigh-Durham market specifically, right now we are in 6 counties, and we're going to be expanding that up to 12. And one of the most exciting parts about North Carolina, for a while we were going back and forth. Let's talk back in July, and I was talking to some of your folks over at Messer as well, and we were looking at, how do we look from a cost standpoint? Are we going to be competitive? Are we not going to be competitive? We really didn't know, and to be totally honest, we didn't really expect to be. We were like, yeah, we'll be in the game, but we don't really know what we're going to sit at. Well, the news came out, I think 2 Fridays ago at like 9 p.m. I get an email. Everybody loves getting an email at 9 p.m. on a Friday night. But at least this one was really good news. And the DOI sent us a list, and we ended up being the low-cost silver plan in the Raleigh-Durham market, which is awesome. We're super excited about it. One of the great things going on too is we switched anchor partners in the state. So for those of you that are familiar with the product now, we're currently partnered with UNC, and we're going to be dropping UNC and switching over to Duke Health and WakeMed. So again, super excited. We think the opportunity is very, very ripe in Raleigh for a Cigna product. There's some other carriers entering North Carolina, as you guys know, and I don't ever disparage other carriers or talk down about them. But one thing I would say is, when you're talking to folks about Cigna in North Carolina, which you all know is a very historically blue dominated state, you don't really have to explain what Cigna is. Most people know what Cigna is. Maybe their dad or their mom worked for a corporation. Our commercial businesses, we have millions and millions of members. So people know us. We're a reputable brand. So I personally think it's going to be a very easy sell in the Raleigh market specifically, and we can't wait to see what happens. And we're going to be rolling out 5 new plans, 1 bronze, 4 silver plans. So I'm sorry that I don't have plan designs in this presentation. We're still building out what those look like in terms of kind of like, I would call them beautifying. I have what the plans are, but creative and all of these folks on the marketing end are putting them into some documents to make them look nice and legible for you guys. And that should be available within the next, I would say, week to 2 weeks for all of our markets. And we're going to make sure we have all that out to Messer, and they can send that to you. So Raleigh-Durham area, pediatric dental on off exchange is going to be bundled. So our PCP and referrals are encouraged. So in North Carolina, we have an HMO product, but that's just the way it's filed. And I know that sounds very strange, but it's filed with the DOI as an HMO, but it really operates as an EPO. So these folks, they don't need a referral, they don't need a PCP, but we just encourage it. So it's really up to their discretion. We're not going to handcuff them on what they want to do. And then we have our national network for pharmacy, urgent care, and retail clinics. And so, like I said before, the new partner with Duke Health and WakeMed. We're changing the naming convention on the ID card. It's going to say HMO Connect Raleigh-Durham with Duke Health and WakeMed, which is cool because so it's not only that they're an anchor partner, but they're looking as a co-branded partner as well. And so again, we're expanding to those 12 counties. And the diabetes care solution, these are going to be for all our markets in totality, not just in North Carolina. And now here's the big one. So the geographic map on the bottom can give you a pretty good idea of what it looks like for our Connect, what we're calling broad network. So let me go back here. This is the Cigna Connect, right? So Cigna Connect Raleigh-Durham network, that's one, just specific to there. And then we're having another network, which is our Cigna Connect broad network. And the broad network is where we're having this huge expansion into the rural parts of the market. So I'm gonna take a sip of water here. I'll let you guys read over what the footprint looks like there on the top right. But we're gonna be going into 55 new counties in the state. And in a lot of these counties, it's gonna be a 2-carrier game. It's going to be us and Blue Cross Blue Shield. And from a pricing perspective, we're going to be within anywhere from 3 to 5% of Blue Cross. So from a network standpoint, it's going to be a very robust network. A lot of these counties are almost one hospital systems, or one system counties, I should say. And we're going to have all of these hospitals within network in these rural parts of the state. So a network will not be an objection whatsoever in the broad market, which we're really excited about. We're going to have a lot more detail around it. I wanted to go into it now, but we've recently sent out in-network letters to a lot of these facilities, so we have to wait. And how I would preface this is, when you use the Cigna search tool, so when you go on our website, if you're talking to customers in the broad network, or really anywhere in our network around the country for that matter, if you see something on our site that says it's in network, it is absolutely in network. Sometimes with big hospital systems, they don't get the information the right way, they don't put it in on their end, or someone at the front desk doesn't know. So I would say always use our search tool as the source of truth in terms of information on what's in and out of network to keep in mind. But again, we're very excited about this. This is the biggest expansion we've ever had in any state. So North Carolina, you're going to continue to see us be aggressive there every year, and ideally have a product statewide. That's what we would like to have in every market we go into. But this is a great start for us. And similar to the Raleigh-Durham network, off exchange going to be bundled. These are all pretty much similar on the left-hand side, from PCP, referral, virtual care. This is going to be the same for all of our states. But on the right-hand side here in this red box, it's showing the 56 counties we're going into. We're going to have over 40 hospitals within our network there, which is great. The new name on the ID card will be North Carolina HMO Connect Broad. So remember, Connect Raleigh-Durham with Duke WakeMed is just for that market specifically, and then HMO Connect Broad, rural parts of the state. And you know what? I'll call out a couple of the anchor partners now, just because I want to get you guys that information, because I know it's important. So in the eastern part of the state, our anchor partners will be Vidant. And in the western part of the state, it's going to be Mission Health and Duke LifePoint. There's obviously a lot of other hospitals within that, but I just want to make sure you guys, have a little bit of an idea of what it looks like. Okay, so let's go into Virginia, because I was told you guys do a little bit of business in Virginia. And then after this, we're going to talk about Tennessee as well. And then we're going to just do a quick high level of all our markets and what you need to know in terms of selling in those markets and things to really remember. So I would probably write that stuff down when we get there. So Virginia, we're rolling out a new plan in Virginia, which is great. And what I mean by that is we're introducing an acupuncture plan. And the reason for this is, if anyone is familiar with Virginia, in Northern Virginia, there's a very large Asian population. And one of the things I'm really excited about is this kind of shows our commitment to the broker community, in the sense that this ask came from the broker community. They said, you need to offer an acupuncture plan. It's important. This is why it's important. And we delivered on that ask. And I tell brokers and agency partners around the country, we really encourage you to give us feedback, because we know that you are the feet on the street. You're in the market. A lot of times you know the market better than us and what it looks like. For example, I'm here in New York City. I come down to North Carolina. I go to all of our markets and interface with all of our broker partners. But some of you who have been selling locally in, let's say, Asheville or Raleigh or wherever it is for 20 years are undoubtedly going to be more of an expert about it than myself. So if you do see a gap and you think that there is something that we are missing, we highly encourage you to bring that to the table. And a lot of times we're going to be able to iterate on that going forward in what we present to the clients. And that's really kind of my point on this slide, is showing that we do that. So the acupuncture benefit will be in the northern, or I shouldn't say northern, all of Virginia market. And they'll have even CSR level plans as well, where it'll be maybe a $0 or a $15 copay when going to see these acupuncturists, and it'll limit it to 20 visits a year. and they'll have medical necessity after 12. So again, my point in this slide for folks who they're like, hey, I don't care about Virginia really, is just think about this. If you do notice things in market, we want your feedback, we value it, and would always appreciate that. Okay, so sales area in Richmond, this is what it looks like here on the right, on this little geographic map. Our big network partners are HCA and Virginia Care Partners. We have others as well, but these are just some of the ones that we want to call out. You know, think about VCU, they're another big partner as well. And we're gonna be introducing 6 new plans going into next year, 1 bronze and 5 silver. So again, on the left-hand side here, very similar to what we talked about in North Carolina, but on the right, we're going to be introducing that acupuncture benefit. It's going to have the acupuncture call out in the naming convention, so it's not confusing for folks. We're going to obviously have those off-exchange silver plans when I was talking about the ICHRA, and then the diabetes solution as well. Northern Virginia. So in Northern Virginia, our big partners are Centera, Valley, and Novant. So think about Northern Virginia as a really big opportunity. If you do sell there, we're going to be the low-cost plan on all metal tiers. Last year, for folks who sell there, Anthem came in. Anthem really undercut the market and was able to take a lot of folks in terms of market share. So we went super aggressive and leaned in on our pricing this year. And you're going to see us be the price leader, not only in Northern Virginia, but also in Richmond. So Virginia as a whole state, Cigna is going to be super competitive in for the upcoming year. So in Northern Virginia, we're expanding into 1 county. It's called Spotsylvania. It's a small county, it's about 3,000 members within it from an addressable live standpoint. So not huge, but still continuing to build out the product. Again, the acupuncture, the off-exchange silver plans, and the diabetes care solutions. And one thing to notice too, all of the networks in all of our states are going to be called Cigna Connect. There's only a few states where that varies, but for the far majority, it'll be Cigna Connect. Okay, Tennessee. So not too far from you folks in North Carolina. Tennessee, in my opinion, outside of North Carolina expansion, is one of, if not the state I am the most excited about, because we are going to have tremendous cost and network, or I should say tremendous cost competitiveness and network adequacy better than almost all of our partners, or I should say not partners, carrier competition. This slide is relatively busy. I'm sorry for all the colors going on if it hurts your eyes here. This is just to point out where we are. We are in Chattanooga, we're in Jackson, Knoxville, Memphis, Nashville, and Tri-City. So when we're looking at these big major metro areas in the state of Tennessee, the ones where we're gonna be the cost leader are Chattanooga, Knoxville, Memphis, Nashville, and in Tri-Cities. So all of those areas will be the cost leader. Jackson, we're a bit priced out. We still have a great product there, but those are the ones that I would say to focus a lot of your attention on when you're going after customers. So this is showing kind of the network partners. You know, we have really great network adequacy in all of our markets within Tennessee, but one of the big call outs I want to give is anyone familiar with the state knows Vanderbilt is by far and away the premier system. It's located in Nashville. And we've been getting asks again from the broker community, you got to get Vanderbilt in, you got to get Vanderbilt in. And this is really talking about for other places. So like people who are in Memphis, or if they're in Tri-Cities area, even though they don't live in Nashville, they want the peace of mind of, God forbid, there is a serious situation with a family member or themselves, they have access to Vanderbilt. So we're super excited to deliver on that this year and make Vanderbilt an in-network option for all of our markets throughout the state. So regardless of where you live, you're able to access the Vandy network, and we think that this is going to be a tremendous selling point. And kind of I guess you would call it the in-Cigna joke is if you're a Nashville member and you don't buy Cigna, you're probably not the brightest of the bunch, or you had a really, really bad experience with Cigna at some point in your healthcare journey here. Because in Nashville, we have unbelievable network. We have the strongest network by far. We're going to have the best price in the market. So there's really no reason not to go with us. And this is very similar sentiment in other markets throughout the state. So this is just talking about a little bit more about the sales area and the Connect network here. Our Take Control Rewards program. This is really a program for individuals to enroll in, and they get rewarded for just monitoring their health and logging it in the system, and they can get gift cards and things like that to spend some money on. We're going to have that super competitive pricing, like I told you guys about. We have the best network partners in the state, and then again, the off-exchange silver plans and diabetic care solutions. All right, so this is the last slide outside of broker tools, and then we'll open up for questions. It's difficult a lot of times to talk to folks about every state, because you start to just tune out, and it's just like a lot of redundancy. You're going over network price over and over again. So this is what I would like to say if I want to just put things together real quick, real easy, and real simple to remember for each state. What are they? We're going to be the low-cost plan in Northern Virginia and Richmond on all tiers in Virginia. In North Carolina, we're the low-cost plan in Raleigh, Durham, with Duke Wake Med as our premier partner, and we're expanding into 61 counties in the state in total. Within Florida, we're the only carrier with Cleveland Clinic and Memorial Healthcare Center in Broward County, which is a major selling point in that area. And we have Orlando Health in network with the best rates with Orlando Health in the Orlando market. In Colorado, we'll be the low-cost bronze plan in Fort Collins. Our rates are currently being refiled in Denver, so we'll see how that pans out. In Arizona, we're in Maricopa County, which is Phoenix, and we're the only carrier with Banner, Honor, and Dignity all in network. No one else has this. This is a major selling point in that market also. In Missouri, BJC and Washington University are both in network, and this is in St. Louis specifically, and we're gonna be the low-cost silver plan in St. Louis and Boone County. In Illinois, I know it's not all of this is necessarily relevant to you guys, but I do like to call this out because we're going to be doing things similar, hopefully, with other systems in the future. In Illinois, in the Chicagoland area, Northwestern is by far the premier system. It's very similar to like a Vanderbilt in Tennessee, and where you're going to have a co-branded product with them in Chicago. We're the only carrier to have that. We are super excited about it. We're rolling out a whole separate network for it. And we think it's going to pick up significant membership in the Illinois market. Tennessee, we're the low-cost plan in Nashville, Chattanooga, Memphis, and Tri-Cities. And again, Vandy will be in network for all of our Tennessee members. So keep that in mind there. And then in Utah, if anyone's selling out there, we're expecting to be the low-cost leader in Salt Lake City. So one of the trends through this, we're still waiting to get some information back on places like Florida, Colorado, Utah. But one thing to remember, I think the trend here is you see us being very competitive in each market that we're in and offering something differentiated to the customer. So this is something that Cigna will continue to double down on with our under 65 business and over 65 business for that matter in our Medicare space, because I do know a lot of you guys and girls sell Medicare as well. Everything within our what we call our government business entity at Cigna is very important to all of our growth going into future years here as an organization. Our commercial product is, we consider to be a very dominant product, a great product. We have millions of members globally on it, but we're looking to really, really be aggressive in expanding our government business in the years to come. And you're gonna definitely see that with our IFP product, and you're definitely gonna see that with our Medicare Advantage product as well. And another big point is as we go into broker tools here, and I wanna call out before we get to kind of what the portal looks like. So commissions, we're going to be very competitive on commissions this year. We're going to be paying $21 per member per month in North Carolina on new business. We will pay renewals as well. So we don't have the actual resources right now that look like this. So like the producer handbook, the individual family plans, this will all be like we'll have all our commissions information on this for you guys. It's just kind of making its way through marketing, compliance, and things like that for distribution. But I'll make sure the folks at Messer have that to get that all out to you. And we're also going to be very aggressive on our bonus plans. So basically think of it, the more you write, the more you get. It'll be a tiered bonus, And again, this is just getting finalized before we distribute it, but it'll be very, very similar to the one we did last year. You know, you write more than 50 lives, you get $5. You write more than 100, $10 per life, etc. So the more the write, the more earning opportunity you have. And unlike some other carriers, there's no cap. We don't cap it whatsoever. So that's pretty great as well. You can enroll whether you want to use a lot of the third-party platforms, doesn't really matter to us. You can enroll directly on our own website. We have an EDE option right on there that you can access in the broker portal and make it super easy for you to enroll customers. Or you can go to, you know, Health Sherpa, Quote It, whatever you guys are comfortable with using. We're pretty much able to be found everywhere. And then lastly, I just wanted to talk about when it comes to resources, we're doing a lot to build on the resources we currently have in place for our broker community. And this is making sure you guys have co-branding materials to push out. So this is really year one, maybe year two, I would say, for Cigna in terms of like really building out what we have in terms of tools for the broker community. And we're doing that through the portal. So everything you would need is in there. So state specific information, whether it's SBCs, plan designs, rates, all in the portal. Your book of business, commissions, also all in the portal. So very easy to get access to the information. We have recordings in there. If you want to find out, hey, I need to learn more about Cigna's dental product, we have very thorough recording in there going over the dental. Or if you just want specific information on certain states, we'll have state recordings as well in there. So I really encourage a lot of people to self-serve and utilize our broker portal. It's cignaforbrokers.com. cignaforbrokers.com. Very simple to get to, and it's a pretty intuitive product, and we're going to continue to even make it better as we go into future years. So that is the most that I have for you guys. I try to keep it relatively high level. I'm sure there will be some questions. So Mike, I don't know how you do that, but if anyone has questions, I'm obviously more than willing to answer them.
Yeah, absolutely. Nick, that was some great information. Guys, I mean, at the end of the day, obviously, until the rates and the benefits are finalized, it's going to be hard to know exactly how competitive, but the point is they are going to be competitive everywhere. So go ahead and get contracted now, because it's just going to get slower and slower as we move forward. And we want to make sure everybody has every opportunity to do what's in the best interest of the clients. And when you've got a reputable company like Cigna, that just is a win-win for everybody. Plus, it seems like they've put in a lot of time and effort into creating a support for our agents and making sure that we have what we need as well. Because we all know that it's great to have benefits, it's great to have rates, but ease of doing business is a huge factor, especially when you're during crunch time and OEP and you need reliable information fast and available. So that's great news, and we're really excited about the opportunities. We do have some questions here. Let me try to run something.
Yeah, Jeff,
do you have any?
So Michael, while you field some questions, I want to actually double down on what you were just saying. It's a good point.
Yep.
As Mike was saying, we are going to be very competitive and aggressive in the years to come. And when I talk to brokers, I'm very candid in saying, you know, Cigna's not a brand that you need to sell. You don't need to sell the brand. People know us. We're a very reputable organization. We pay costs, or I should say we pay claims at a much higher rate than a lot of our competitors. So you could know that your members are going to be taken care of. We've been in the ACA exchanges from day one. We're not like a lot of the other ACA I should call them legacy carriers. I'm not going to throw any names, but legacy carriers out there who pulled out of the market in previous years because they were losing money. Cigna was also losing lots of money in the exchanges, but decided to commit to the market and make it a profitable business unit for us. And now that we finally have done that, you're going to see a lot of the resources, time, and dedication going to that product. And a lot of that focus will be on the broker community to make sure you guys have what you need to sell. And my job very clearly is to make business easy to do with and make sure you guys are supported from a compensation standpoint, from a tool standpoint, and really just from an overall ease of doing business standpoint. So we are very, very happy about the relationship with Messer. We value it tremendously. whether it's on our IFP product or on our Medicare Advantage product, and we can't wait to continue to kind of partner going into the future. And whatever you guys need, you let them know, and we're gonna hopefully deliver on those promises.
And I want to, and Nick, can you pull back up the North Carolina map so people can see the counties again? I will say
Yep.
this, guys, if you notice on here, there's a lot of areas where there's only one other carrier option available too, where Cigna is going to be expanding into. So for those of you that have been just dying for another option besides one carrier, here it is. We've got your opportunity. So make sure to take good notes on it. So there's all the counties that they're going to be in. A lot of rural areas, a lot of where, like I said, it's been so blue for so long. I mean, you've had your clients probably have had it. Their parents had it. Their parents' parents had it. It's time to start changing the way they think and start showing that there's better options out there available to them. Let's see. One of the questions here, Nick, was, is there a limit on how many insulin products at $25 per month?
Is there a limit on, say again, I'm sorry?
On how many of the insulin products at $25 per month? Is there a limit on how many times they can use that?
Oh, no. Okay, so I'll answer that two ways, because I think it might be interpreted two different ways. Is there a limit on the amount of products in terms of brands and the ones that are being offered? Yes. So we'll have certain ones that we will offer from a branding standpoint. So, you know, let's say there's insulin A, B, C, D. Maybe we'll have just A, B rather than C, D. I will tell you, I do know that insulin products are pretty agnostic in the way that they work. So there's really no difference besides the brand names most of the time. And in terms of, is there a cap on how many times you can use it? So it's every month. So it's basically, it's a 30-day supply. So typically diabetics go to the pharmacy once a month. They get their supply for the entire month. They put it in the refrigerator to keep it cold. And they'll be able to get that monthly supply every month at a capped price. So yes, I guess those are the two ways I interpret that question.
Yep, I think that answers it. Here's a scenario. If a North Carolina member is on vacation in Florida, can they use a Cigna in-network doctor and urgent care as in-network, or will that be not covered?
So great question. So no, the short answer is no. The long answer is, so none of the ACA networks for Cigna are intertwined at the moment, and that's why they're not PPO networks. I do think there is a place that we do get in the future where that will happen, but at the current moment it's not, and that's why I said to really leverage the virtual care options when people are out of network. But I also want to point out, this is not unique to Cigna. This is very much a ACA under 65 carrier kind of standard. I do know the Blues have PPO options in a lot of their states, but they're very, very expensive. And in my personal opinion, a lot of times unwarranted. You know, if you have a member, again, who, let's say they're in North Carolina and they ski and they break their leg on a mountain out in Colorado, they're going to get care at an in-network charge. So it's really, the only time I would say that it would be a big deal is if they were looking to see a specific doctor in a specific state. You know, if they wanted to fly to New York to see a doctor or somewhere else, that would be the only time it would really matter. But at the current moment, no, they would not be able to see doctors that are in network in other states like Florida if they're a North Carolina member. We do have the National Urgent Care Network though, so they will be able to use that, which is good.
Another question was, how can we get signed on with Cigna, and is there a fee? So I want to make sure that everybody is clear on this. There is no production requirements and there are no fees to contract with Cigna under 65. And if you're wanting to do so, you can contact us. You can go to our website, messerfinancial.com. It'll be under Agent Resources. There's a contracting link where you can request all the appointments in there as well. So again, there's no fees, no production requirements. If you're planning on writing any ACA and getting FFM certified, then I would recommend going ahead and getting appointed with them. Obviously, again, we won't know the rates until probably right before the open enrollment begins, but just keep an eye out in healthcare.gov, because sometimes they give you maybe a day or two advance notice to be able to quote. And obviously, we'll be letting people know that as well, so we can get some kind of actual visual on just how competitive they're actually going to be. And Nick, there's a lot of questions about Florida. I know there's not too much information on there. Can you just go over real quick again where you're going to be, or at least where you think that there's some opportunity for you?
In Florida?
Yes, please.
Yeah, so in South Florida, in Broward County, we're expecting that to be a huge opportunity for us. So Broward, as well as Palm Beach and Orlando, those are the three that stick out to me if you want to talk about competitiveness. And I really encourage you guys to join the Florida webinar. I know Florida is huge in terms of opportunity for the broker community. And Micah, I'm going to send you the webinar lists of all of our states, and I would appreciate if you could send it out to everybody on the call, because I think Florida is one of those markets. I've always defined it as like its own little beast, and it really deserves its own attention and time to it. So join that webinar. I think you'll be very happy to hear what we have on it, but if you want to just know like the high level, Broward, Palm Beach, Orlando, that's where we're expecting to be very competitive, and there are a lot of addressable lives there for us. And then the other thing, to piggyback on what you were saying before, Micah, we pay commissions on exchange, off exchange, SCP, doesn't matter to us. We're going to pay you guys for the work that you do, to keep that in mind as well.
Could you explain your Cigna National Urgent Care Network?
Yeah, so this is another thing I want to send out to you guys. I'm going to send out a list of all the national network. I think we had a little, so right here. So we have a national network for our pharmacy, urgent care, and retail clinics. So essentially this is a list of urgent cares that folks can go to within different states around the country and have an in-network fee. So this would be another example when I say I want people to be using the tool on their phone, because it'll show them where those in-network urgent cares are in relevance to their geographic location. So again, it's obviously a very robust list, but the best way to think about it is there's urgent cares around the country. We contract with certain ones that we have in-network for all of our members. And I would have them use the MYCIGNA app on their phone to make sure they're going to the right ones when they're out of area.
Do you have also a list of local agent managers or broker managers that for some of the agents that are out of state and other states around the country?
Yeah. So you ready? It's just me.
There you go.
So I'm your guy. Yeah. I'm your guy. So I cover a lot of states for Cigna. I cover a lot of our national agency relationships. So whatever you need, we'll get it for you. We have a pretty good team in-house who can do things, but in terms of having someone dedicated by state, we just don't have it. I cover a lot of the states for the organization.
Perfect. I'm just checking to see if there's any other questions here. Let's see.
And actually, you know what, Mike? I want
just to clarify. Oh, I'm sorry. Yep, go ahead.
Yeah, I just wanted to also stay on top of that. So one thing we have heard in the past, and I don't want to like avoid it, is we've had brokers say, oh, yeah, you're here. Let's use North Carolina example. You're here, but you're not technically in market, meaning we don't have a person in market like myself. As I told you guys, I live in New York, and I really fly into markets with most often and see you guys and talk to you and do that. So I'm on the road a lot throughout the year. Obviously not this year, but during the year, that's what I kind of do. But we are in market. I mean, we have a market president, right? For every market we're in, we have, I think in North Carolina, we definitely have north of 100 employees within the state, because we have our commercial products obviously everywhere. So we're definitely in market. We just might not have an IFP resource located in your market. And I think the reason for that is, as we're on this call right now, a lot of people know it's a seasonal business. So from the carrier side, we're doing a lot of work from January up until right now to make sure we're successful in those 3-month time span. And so to have someone like myself in market is not something that we really think is the right move, at least at the time. Maybe in the future.
if an agent is unable to find the answers that they're looking for, are they able to contact you directly? And if so,
Yeah,
can you give your contact info?
yeah, Micah, do you mind just sending that out to everyone to make it easier?
Yep.
You
Well,
can
we
send
can
them my
send that
email
to
and my
everybody
phone.
that's on this webinar. Absolutely.
Yeah, that's good.
Yes. Yes.
You guys can contact me. We have a really good broker support team as well for kind of just like, I would say, you know, normal questions. Hey, how do I get appointed? Or, which obviously Messer is able to help you with. But if you have like little questions on a customer, you can flag that to broker support. But also feel free to contact me. I'm pretty available. You know, sometimes if I don't answer a call, I will get back to you. But email is definitely the easiest way, I would say, to get in touch with me.
Yes, and Tom, I know that you're kind of upset that you wish you had a little more information about Florida, but I can assure you that this is the guy. And this webinar is also for Florida agents, and we're giving you everything that we have as of right now, and we will continue to keep adding information. And plus, I'm presenting you with the person who is in charge of that market as well. So yes, it is for North Carolina, Tennessee, and Florida, and all the states that we market it for, and they are going to be competitive, and we would love to partner with you guys. So it looks like that's really all the questions that we have for today, Nick. Yeah, go ahead.
Hey, Micah. Yeah, I want to say, you said his guy's name's Tom, so if Tom's listening, still on the call. So I have a counterpart. She's my only counterpart who handles, you know, broker distribution, and she works specifically in Florida. And that's why I said I really think it's important for you guys to join that webinar. And the reason is Florida is really a bilingual state. I am unfortunately not bilingual. So we have to dedicate someone who is, and she fortunately is bilingual to deal with it. And that's why I think, again, that we have you guys on that webinar, because it's going to be very robust in terms of information and what we're looking at, because Florida is a tremendous opportunity for the organization. It's the biggest ACA market in the country. So I didn't want to do a disservice to it and just kind of breeze through here. So I think once we can, I'll get that information out to Micah. He'll blast it out, and definitely join that webinar to get the information on it.
Where should they go to find where the next upcoming webinars are for you, the state-specific ones?
Yeah, I'm going to send that to you to send that to them, because basically it's a link that has every state on it that we're in, and they can just register for whichever one they want. It's more of like a, you know, they can customize whether they want to go see an Illinois one, Missouri, Florida, whatever it is, rather than just doing a large presentation.
That'll work.
And it'll also be more helpful. Yeah, sorry, I was going to say it'll be more helpful than me right now, because by the time we have that Florida webinar, we'll know a lot more answers in terms of price. All of our in-network letters will be received and documented. So I just didn't want to give, didn't want to give thin information on Florida for you guys. I want to make sure we have everything solidified for when you get it.
And don't worry, guys, open enrollment's not until November 1st. So it's not like MA where it's just right around the corner. We do have time to get everybody prepared and educated. And as more information comes available, we will send it out as much as we possibly can. And like I said, keep an eye out for, right before November 1st, maybe healthcare.gov will let you get on there and quote around a little bit or something like that. But until then, this is really everything that we have. And if you do have any other questions, concerns, you have many resources. We are trying to partner everybody, I think, between Nick, myself, the other marketers, our staff here at Messer Financial, and your guys' effort. Success is basically inevitable. So we really look forward to partnering with everybody. Nick, I really appreciate your time for joining us today. Is there anything you want to say in parting?
No, just that again, this isn't just cliche, me coming on a call to say this. We really value this partnership with Messer. And when it comes to more information and you guys want to know things like cost, I know that's the name of the game in the ACA exchanges. You guys are definitely going to have that information, no doubt about it. If it was up to me, we'd have it already, but unfortunately, every DOI works a little differently in the way they release it. So like how I know in Raleigh and North Carolina, we're going to be the most competitive plan in that market. I don't know things about Orlando or Utah or other parts of the country, but as soon as we get that information leading up to OE, well, definitely going to blast it out to the folks at Messer, and they can send it to their entire agent population so you guys have it.
All right. Well, thanks again, Nick. We appreciate everybody. Keep an eye out for the future webinars that are going to be coming up. More information will be sent out as well. So always be sure to check your emails. Again, thank you to everyone for coming out, and have a great day. Thank you, everyone. Bye-bye.